Morning, everybody, and welcome. Thank you for coming to our seventh Learning Collaborative, the seventh one, and this is our first one for the year 2025. This is the Cal Reentry Initiative Learning Collaborative. This one's going to be on Consolidated Appropriations Act, also known as CAA. You'll hear us say CAA often when we are talking about that. A little bit about the webinar and everything before we get going. Your microphones will be muted. Only the presenters will be speaking at this time. Please turn up your audio so you can hear everything that's going on. Use your Q&A feature at the bottom of the screen to ask for questions or share any feedback that you have. And as usual, our session will be recorded and captioned. Caption recordings and transcripts will be provided by DHCS on their website. Next slide, please. And again, welcome. Today's February 6th, and it's our first Learning Collaborative of 2025, and we are so excited to start and have it with you guys. Next slide, please. For those that don't know, my name is Greg Tate. I'm a section chief here at the California Department of Healthcare Services Oversight Office of Strategic Partnership, and our Deputy Director, Autumn Boylan. She's normally on the call. I think she has a conflict today, but I get the honor to introduce our new branch chief. Her name is Sheila Abuke. I'm going to go mute for a second and let Sheila introduce herself, and then I'll go through the rest of the people on this screen here. Go ahead, Sheila.
Thank you, Greg. Really appreciate it. Hello, everyone. As Greg mentioned, my name is Sheila Abuke. I'm really excited to be joining this team, again, as Greg mentioned, as the new branch chief overseeing the Justice Involved Reentry branch. A little bit of background information on me. I previously managed the Delivery System and Operations branch, which was the other side of the house of Office of Strategic Partnerships. And I was responsible for overseeing multiple work streams under the Children and Youth Behavioral Health Initiative. This is my first time participating in a learning collaborative, and I am looking forward to engaging with all of you on the call and learning from the diverse perspectives and experiences that are in the room today. I'm still onboarding, but I have picked up on the importance and impact of this large initiative, and I really believe there's so much we can all accomplish together. And I'm just really excited to get started and look forward to working with you all throughout this initiative. I'll go ahead and pass it back over to Greg. Thank you.
Thank you, Sheila. And we're so excited to have you here. Under Sheila, of course, is myself, Section Chief Greg Tate. And on the other side of the house, Lawana Welch. Our managers are the unit chiefs under us, Michael Gillis, Mike Hadeen, and Miss Megan Shandell. And my next introduction is someone that's been with the program, helping us all throughout, but he is definitely going to be the expert on this topic. That's Brian Hansen. He's a policy advisor from the Directorate Office, and we're so happy to have him here. He's going to be going over pretty much everything for this Consolidated Appropriation Act presentation. And right after we do this next poll, I will turn it over to him and let him take it over. So next slide, please. And as usual, we would like to know, what is the role that you play here in the Reentry Initiative program? Sorry, pops in my face. We want to know, who are you? Are you with the county jails, county youth correctional facilities, county correctional healthcare service entities, county sheriff's office, CDCR, CCHCS, county behavioral health agency, social services, managed care plans, reentry provider, ECM providers, or other, whichever one you would like to click. The screen poll should have came up, and I see a lot of people clicking in already. A lot of BH here. We appreciate you guys being here. See some county sheriff office individuals, some others, which either way it goes, we appreciate that. And hopefully we have a wonderful presentation and you guys learn from this learning collaborative. Once this poll is completed, I will pass it over to Mr. Brian Hansen. Thank you so much.
Good morning. Actually, my name's Ashley Deli. I'll be taking it from here. Thank you, Greg. We're going to get started with today's webinar by doing a recap of the Fall 2024 Learning Collaboratives. So next slide, please. Last year, we kicked off the Learning Collaborative series with an overview of the program in the Learning Collaborative Session 1. Subsequent sessions included the GI screening portal, behavioral health, physical health, and care management services. And then our last webinar discussed all pharmacy-related topics. You'll see on the screen that there are some links noted at the bottom of the slide. And so the YouTube links to these recordings will be provided as part of the materials for this presentation. Next slide, please. All right. At this time, we would like to offer you the opportunity to share your feedback on future potential webinar topics for 2025. On this slide, you'll see we provided some examples for you to consider. You are welcome to use these examples in your suggestions, or we welcome topics of your own. We do ask that you provide specific information, as any details you can provide us are very helpful. And so at this time, I encourage you to use the Zoom chat to start entering your suggestions for future topics. And I'll go ahead and pause for a moment while you get started. We can go ahead and move on to the next slide. And feel free throughout the course of this webinar, if any topics come to mind, please feel free to use that chat and add those at any time. So let's go ahead and discuss what's on the agenda for today's session. The remaining items for today include the discussion on the federal requirements of the CAA of 2023, including an overview of the requirements under sections 2121 and 5122. We're really hoping to expand your knowledge on the CAA required services and their alignment with the GI Reentry Initiative. Lastly, we're going to allow some time to review the frequently asked questions that we've received, and we're going to offer a moment to address some of your questions during the live Q&A portion of this webinar. And following that, we'll wrap up and review the next steps. So at this time, I would like to pass it over to my colleague, Brian Hansen. Thank you.
Thank you, Ashley. Welcome, everyone. Nice to be here. Next slide, please. Okay. What I'm going to do is I'm going to talk a little bit about what the Consolidated Appropriations Act is, and then I'm going to walk through in some detail an alignment between the requirements in the CAA and the requirements under the GI Reentry Initiative. I'll take about 20 minutes, and then we'll go through some questions. The CAA was passed, the federal CAA was passed in December of 2022. It includes two provisions that impact incarcerated youth populations. Section 5121 requires pre- and post-release care management and screening and diagnostic services for post-disposition youth, and it is mandatory for all states to implement. Section 5122 gives states the option to cover full scope Medicaid for predisposition youth. Full scope Medicaid for predisposition youth. I will say, if anybody wants to dig into the details of these two requirements, there's a link there below for a state health official letter, and you'll get about 30 pages of detail on these provisions. Next slide. So the first 5121, the mandatory requirement, this requirement, Medicaid and CHIP programs must provide certain services to Medicaid and CHIP eligible youth who are incarcerated post-disposition. Medicaid and CHIP programs are required to have a plan in place describing how mandatory coverage will go into effect on January 1st, 2025, including in the 30 days prior to release or within 1 week or as soon as practicable after release, certain screening and diagnostic services in accordance with the early and periodic screening, diagnostic, and treatment requirements for Medicaid or the approved CHIP state plan, including behavioral health screenings or developmental, vision, hearing, dental screenings, diagnostic services, and appropriate immunizations to eligible juveniles who are post-adjudication in public institutions. In addition to that list of services related to screening and diagnostic requirements, in the 30 days prior to release and for at least 30 days post-release, targeted case management services for Medicaid and case management services otherwise available under the approved CHIP state plan. This includes referrals to appropriate care and services in the geographic regions of home and residence for the eligible juvenile where feasible. Now, this last box here on this slide is the important part. Because of the significant overlap of this requirement, 5121, and the JI Reentry Initiative we've all been working on, DHCS retrieved approval from the federal government to subsume this requirement into the JI Reentry Initiative. What that means is, as it relates to the requirements in the CAA under this mandatory initiative, when we talk about the timing of when it has to be implemented, when we talk about the services that have to be implemented, if your correctional facility and you all are implementing according to the guidance that CMS or DHCS is putting out for the JI Reentry Initiative, you are in compliance with the CAA. Nothing different will be required in addition to the guidance that DHCS is putting out for the JI Reentry Initiative. So that should relieve some pressure from folks who are a little worried about, some services they don't recognize in this list or the January 1st, 2025 date. I'm going to walk through this in more detail. Much of the rest of the slide deck is sort of a detailed side-by-side how the JI Reentry Initiative aligns with the CAA, and a couple areas where we've made some minor modifications to make it align. Next slide. Now, the optional provision is 5122. Under that provision, states have the option to provide full scope Medicaid and CHIP coverage, full scope being a much broader set of services than what the JI Reentry Initiative provides, to eligible youth who are incarcerated in a public institution during the pre-disposition, pre-adjudication period. California, like most states across the country, intends to first roll out the Reentry Initiative, which will subsume CAA Section 5121 requirements as described in subsequent slides. And the only thing I'll say about this section is that California, to be clear, has not chosen to adopt this optional provision at this time. We are continuing to assess the option in collaboration with stakeholders, particularly including our state probation departments around the state. There'll be more discussions on this as we move forward, and we will keep folks informed about that assessment process. We have not adopted this, and there is no firm plan to do that in the near future. Next slide. Now let's talk about the alignment. Next slide. So there is alignment between the CAA and California's already launched JI Reentry Initiative. As a result, California received approval from the federal government to fully fold the CAA requirements 5121 into the overall JI Reentry Initiative. This will occur according to the regular timeline of the JI Reentry Initiative, according to whatever starting time frame your counties are selecting between October 2024 and October 2026. And I will say this approval we received is from the Centers for Medicare and Medicaid Services. They are the federal organization that is in charge of implementing the CAA requirements. So we heard it from the horse's mouth, if you will. Required services and alignment approach. The following services are folded in. So coverage for screening and diagnostic services in accordance with Medicaid requirements. I will say there was a term EPSDT, early and periodic screening, diagnostic and treatment. That term is just a term that Medicaid uses to talk about the benefit package that's available for youth under Medicaid. Under 5121, only the screening and diagnostic portions of that package are implicated. The treatment portions of that package are not. So don't worry too much about that EPSDT term. In addition, we heard a term of targeted case management, TCM. That is, again, a Medicaid term for case management. I wouldn't worry too much about that term. It is just aligned with the case management requirements we have under our JI Reentry Initiative. So for impacted populations, we have Medicaid, CHIP eligible youth under CAA, who are under 21 or former foster youth up to age 26 and post adjudication. Correctional facilities will be deemed to meet CAA requirements if they receive approval, conditional approval, during the readiness assessment process to go live with the JI Reentry Initiative services. I'm saying the same thing a couple times, different ways, just hopefully it comes through. Next slide. Eligible populations. The Reentry Initiative eligibility includes adults, children, and youth who are enrolled in Medicaid and CHIP, incarcerated pre or post adjudication, and adults who are diagnosed with a mental illness, substance use disorder, chronic conditions, significant clinical condition, IDD, TBI, HIV, or are pregnant or postpartum. Youth do not need to meet a specific healthcare criteria to be eligible for the program. Now, comparing that to the CAA mandatory services, youth reentry services, it is post-adjudication, children and youth who are enrolled in Medicaid or CHIP, under 21 years old or between 18 and 26, under the mandatory former foster care eligibility group, and incarcerated post-adjudication. What this means, to establish full alignment, DHCS has modified our program, our JI Reentry program, a little bit to update the definition of youth from incarcerated in a youth correctional facility to any youth who meets the CAA age definition of youth. Some changes around former foster care, etc. Because the CalAIM JI initiative is for pre and post adjudication individuals, correctional facilities will not need to distinguish between these populations. Both will be covered under the JI Reentry initiative. Next slide. Scope of facilities, direct alignment between the JI Reentry initiative and the CAA. It covers state prisons, county jails, and youth correctional facilities. So we're fully aligned. Next slide. Scope of services. Under the JI Reentry Initiative, as we probably all know, we have care management, physical and behavioral health clinical consultation services, lab and radiology, medications and medication administration, medications for SUD, CHW services, and a 30-day supply of medication and DME on release. Under the CAA, the mandatory services include that targeted case management we talked about, in the 30 days pre-release and for at least 30 days post-release, screening and diagnostic services, 30 days pre-release, including behavioral health screenings or developmental, vision, hearing, and dental screening, diagnostic services, and appropriate immunizations. Now, implications for California, the CAA services are closely aligned with the JI Reentry Initiative services. Correctional facilities are responsible for ensuring access to all screening and diagnostic services, including dental exams and appropriate immunizations. Yeah. So the main question correctional facilities, I think, would be asking, or people who are implementing this program, are any additional services required other than what we were planning to do under the JI pre-release services reentry initiative? CAA requires some services that are not really emphasized in the CalAIM JI Reentry Initiative. Examples include immunizations and dental screenings. You'll see a little additional guidance on this in our new policy guide when it comes out soon. Other than that, nothing additional is required. Next slide. Now, for this case management, I'm going to walk through a few slides, and I'm going to break case management into the different elements that DHCS has as part of our case management benefit and compare that to what's required under CAA. So for the reentry initiative, we have a comprehensive health risk assessment. CAA has a comprehensive needs assessment, health, behavioral health, health-related social needs. Reentry initiative includes development of a reentry care plan. The CAA requires development of a person-centered care plan, including social, educational, and other underlying needs. Alignment, check, check for those two boxes. Next slide. The Reentry Initiative requires facilitation of warm handoffs and or behavioral health links to post-release care managers and community-based services. It requires scheduling and arranging necessary appointments for services provided in the community, and it requires coordinating stabilizing treatment prior to release. CAA requires referrals and related activities, appointment scheduling to link individuals to needed services in the community. Check the box on alignment there. Next slide. Continuing with case management, JI Reentry Initiative requires follow-up with the individual and community-based providers to ensure post-release engagement was made with the individual no later than 30 days from release. CAA requires monitoring and follow-up activities, follow-up with the service providers to ensure the care plan is implemented. And then the Reentry Initiative requires obtaining informed consent when needed to furnish services and or share information. There aren't any requirements in the CAA on this, though there are other federal requirements that align with what we're doing. So we're good there. Next slide. Okay, case management pre and post-release timing. Again, the Reentry Initiative will fully subsume the case management services requirements under 5121. All services under the Reentry Initiative will be provided 90 days prior to, up to 90 days prior to expected date of release. The Reentry Initiative timing is 90 days prior to expected release, or as much time as you have in that window. Post-release timing is this. ECM providers should meet the individual within 2 business days of release. A second follow-up appointment is also required within 1 week of release. Post-release ECM is authorized by DHCS and the plans for 12 months post-release for all managed care members. Fee-for-service members will receive, fee-for-service members, very, very small proportion of our folks, 1, 2, maybe 3%, will receive case management in the community under fee-for-service bundle number 5 for 28 days, up to 28 days post-release. And then under CAA, pre-release timing is 30 days prior to the expected release. Post-release timing is at least 30 days post-release. So another important box, facilities will be able to bill for all services, inclusive of CAA services, during the 90-day pre-release period. If screening and diagnostic services occur at intake and outside of the 90-day pre-release window, these services cannot be billed to Medicaid. Individuals should only be rescreened in the pre-release period as clinically appropriate. So what that just means is that if you have somebody who's in for longer than a 90-day period and you provide that initial screening outside of the 90-day period, you can't bill for that. But anything that happens in the 90-day period can be billed for to DHCS. Next slide. Screening and diagnostic service definitions. The JI Reentry Initiative definition of clinical consultation will fully subsume the screening and diagnostic service requirements under CAA 5121. So under the Reentry Initiative, physical, behavioral health, and dental examinations will be covered under clinical consultation. And behavioral health assessments, physical health evaluations, and some procedures and immunizations are also covered under that. For the CAA, comprehensive health, developmental history, and unclothed physical examinations, appropriate vision, hearing, and lab testing, and dental screening services, as well as diagnosis of defects in vision, hearing, dental, and immunizations. So again, we will have complete alignment across those, the Reentry Initiative and the CAA requirements. Next slide. Continuing the clinical consultation alignment. Under the Reentry Initiative, also outpatient clinician services to treat or stabilize individuals such as behavioral health therapy, physician-administered medications, and the prescribing of medications is covered. Under the CAA, there's no additional requirements under this, so we're good. Next slide. And that is the end of our crosswalk. And I think we're going to open it up to questions or cover some advanced questions or something at this time.
Thanks, Brian. We had a couple that were sent in ahead of time, but in the meantime, we're also going to be going through the questions in the link. Actually, I'll start there. I see one from Stephanie. Are dental services, screenings, and dental needs now covered costs through the JI initiative? Brian?
Yeah, I would say that dental screenings and dental exam for screening purposes will be covered under the JI Reentry Initiative. We are doing some work right now to ensure that we have the proper codes covered in our clinical consultation services code set to ensure that the correctional facilities can bill for those screening services. I will say that does not include all dental services. It includes the dental screening and exam for screening services.
All right, great. And remember, if you'd like to ask a question, just raise your hand. And if I don't see it, someone will call it out for me. Next, we have our providers able to bill directly via the JI portal. And let's see, I guess that's going to be, go ahead.
Yeah, I can take that. I'm just going to, we all know this, but anybody on the team, the DHCS team, if anybody has any clarifications or wants to tell me I missed the mark, please do feel free to speak up anytime. Correctional facilities will not be billing through the JI portal. The JI portal is utilized to check some information from the correctional facility about the individual in our DHCS systems, and to more importantly, turn on the JI aid code that makes that individual eligible for the JI pre-release services billing element. It changes their eligibility category. Billing will happen through largely, I mean, billing is a complicated area, but billing, we have extensive guidance on billing other places. Primarily, billing is done through fee-for-service billing apparatus through our AMIS billing system by filing claims. In some cases, limited cases, it is done through the short Doyle system for catching a warm link on the behavioral health side. And then for, post-release services, if we're talking about the CAA, people go into managed care post-release and they get ECM services. Those ECM services post-release in managed care are paid for by the managed care plan.
Great. If upon screening dental care is required, are those costs covered under JI? If yes, is there going to be a list of provided covered services? And are these services going to be extended to the adult populations in jail or prison?
I would say that there is no difference, between the services that are available between the adult and youth population. We have direct alignment between the CAA and between CAA service requirements and what's available in the JI pre-release services for adults and youth. There are some eligibility differences between youth and adults. But dental treatments as a general category, I would say dental treatments are not a service that is covered. However, I would reference folks to dig in where we can point folks to the list of clinical consultation service codes that are available. There may be some clinical consultation service codes that are available that can be used as part of dental treatments, but by and large, dental procedures are not a covered service under the JI pre-release services program. Anybody on the team, DHCS, want to clarify anything there? Cool.
Sounds good. All right, next, will DHCS be publishing a JI fee schedule so we know all the codes are billable under JI and can program our EHRs accordingly? Ashley, you're up.
Thanks, Jill. So there is a rates schedule already published on the website, and I can drop the link into the chat. I can also offer a link to the Medi-Cal provider manual, as well as a link to the repository for all our published articles regarding JI. And there is an article in there that calls out some of the codes that are permissible for JI. And if upon reviewing that information, you still have additional questions, you're welcome to reach out to our inbox, and we can direct those questions over to our billing partners. Thank you.
Great. I see a couple questions. I'm going to go to one asked previously. If a youth correctional facility will not be going live until 2026, are there any actions that the facility must take in the interim? Brian?
Yeah. There is nothing additional required outside of what is required for the JI Reentry Initiative. So there's nothing special required for CAA. As I said before, we may clarify a little guidance of what's included in the JI Reentry Initiative around some specific services that are emphasized by CAA, like the dental screenings and immunizations. And all of our counties should be thinking about their timing and their readiness process when they're going to go live with the JI Reentry Initiative. They should be doing the planning right now, picking their go live date if they haven't already gone live, and they will move through the readiness review process with our DHCS team here, and moving through that process, picking their go live date, getting approved for go live, conditional approval, whatever it is, and going live will maintain compliance with CAA. There's nothing additional required. So, as long as you're just doing what you need to be doing for the JI Reentry Initiative to get ready and launch, which there's plenty to get ready to launch for that, you're doing that, then you're covered for CAA.
Great. There's a question here that says we do not identify individuals in our county jails between the age of 18 and 26 who grew up in foster care. Does CAA require us to do so as long as we are proceeding with JI? Brian, I'm sending it back to you.
Yeah, I'm going to say we had a slide that talked about this. DHCS, again, anything that required any tweaks to the JI Reentry Initiative to comply with CAA, we have done or are in the process of making. One of those tweaks was to change our youth eligibility criteria just a little bit to cover the 18 to 26 or up to 26-year-old former foster youth category eligibility. So that is our current guidance around that. So I won't refer to it as because of the CAA. I'll say it's part of our GI Reentry Initiative requirements now. And then I will turn it over. Do we have Sarah Linder on the phone to speak to?
I'm here. Hi, everyone. Good afternoon or morning. Sorry. Sarah Linder from our eligibility division. So currently, as Brian has described, the former foster youth is a designation that should be identified as it allows those individuals to be enrolled in JI without meeting the health criteria in alignment with the policy for use. And that helps us comply with the requirements of the CAA. So DHCS is actively developing a mechanism within the JI screening portal that will alert or inform a correctional facility of an individual's former foster youth designation if it is on file with the Social Services Department and DHCS. And then until that is implemented, correctional facilities can ask the member if they are a former foster youth and rely on their self-attestation to enroll them under the youth category if they do identify themselves as former foster youth.
And I see another question related to that, so I'm just gonna follow up with that. If an adult age 25 at county jail who's a former foster youth eligible for CAA while at the jail.
I'm sorry, is Jill cutting out for anyone else, or is that my computer?
Yeah, no, Brian, we're losing you a little bit.
Anyone?
The question was, if an adult age 25 at county jail who is former foster youth eligible for CAA while still at the jail? So that's the question. Sorry, Jill, you were cutting out. Might be this bad weather. So
No worries. Thanks. Go ahead, Brian.
Yeah, I think the question was if you have somebody who's 25 in an adult jail who's former foster youth, do the youth eligibility requirements apply under the JI Reentry Initiative? And the answer is yes.
Okay, great. I'm going to ask a second question that we had submitted earlier, and please let me know if I'm breaking up again. May a facility provide CAA services prior to being determined ready to go live with pre-release services? Brian?
Yeah, facilities are providing services now outside of, the JI Reentry requirements. Facilities are completely able to provide any additional CAA related services prior to the JI Reentry Initiative go live. I would say that the JI Reentry Initiative does not go live until formal go live. And what is connected with that is Medicaid, DHCS, Medi-Cal reimbursement for any of those services. So while a facility could, in theory, provide these additional CAA required services prior to DHCS approval of their go live date, there will not be JI Reentry Program Medicaid reimbursement for any services prior to official go live.
Okay, great. And for the dental screenings, are those billed fee for service? Brian or Ashley, I'm not sure on this one.
Yes, I'll just, because I'm still off mute, I'll just keep talking. All of our
Keep going.
all of our pre-release services are billed fee for service, and there's only a very small exception for the behavioral health agency catching a behavioral health link that is billed through short dial. Everything else is billed fee for service through CAMIS directly to DHCS. And this will be under our clinical consultation category of services. Yes, billed fee for service.
Great. Will there be any difference in billing for CAA covered services and the 1115 reentry services? Ashley?
Yes, thank you, Jill. There are no differences in billing for CAA covered services and the 1115 reentry services. DHCS is in the process of evaluating codes and provider types to implement the dental screening requirement and will provide guidance at a later time. Thank you.
Great. And I do just want to do a shout. If you want to raise your hand, you're welcome to do so, and we will call on you. Otherwise, I'm just going to keep going through our good questions. Let's see. County behavioral health agencies were required to go live with JI reentry services in October, regardless of whether the correctional facilities were live or not. Imperial County has not received any notification on our readiness assessment. Will DHCS be sending those out soon? That Mike, Greg, do you know that, or Michael Gillis? I'm not sure.
Michael Gillis, to see if he's received the readiness assessment for approval. Michael, are you available?
Which RA?
Imperial County, sir.
Imperial County. I think it's just when were they going to get notified in general? How will agencies be notified?
And I was clear if we're talking about the county correctional facility or the county behavioral health agency relative to readiness.
It looks like this is for correctional facilities. And Victoria, if you want to come off and ask more about this, you're welcome to.
I believe we're hearing it's from BH facilities. Imperial Correctional Readiness Assessment hasn't been received yet. So the way that the correctional facility go live process works is the Department of Healthcare Services will send out a notification notifying the county of their readiness assessment completion and approval for the correctional facility readiness assessment. In this process, there are additional steps that the county needs to go through, like setting up the portal, getting into the provider enrollment system and the like. So we will be actively actually reaching out probably a week or two prior to that go live date. So for Imperial County, and I believe we would need you guys to reach out to us directly for some more information because we have not received a correctional facility readiness assessment. And then on the behavioral health side, I will defer over to our management team on that side of the house. Luana Welch, do you guys have anything else you'd like to add for the behavioral health side?
Yeah, because I'm trying to pull up their information. I saw that they did submit it. We can get back to you guys directly. You should have heard from us if we already received it. I looked in the system and I did review that, so it has been through our portion. So I'll take it back to our team just to make sure that you guys got something from us.
That's great. All right, let's see. I'm still looking for hands. I don't see any hands. Let's see. Are vision and hearing screenings covered under JI? Let's see. Brian, you want to jump in? Or?
Brian, they are, right?
Yes.
Just checking. Thank you, Kinda, from Manat, one of our support people here. Thanks so much. All right, let's see. Can a CalAIM and CAA alignment services have any impact in the adult population or just the youth population? I know we addressed this, but if you could talk a little bit more about that, Brian, I think it's a source of concern.
I can't think of anything else to add other than what we've said through the presentation about the alignment of the services. That's all I've got, unless there's a clarifying question or anyone else has anything to add.
This is Sarah. The only thing I would add is it would be for those former foster youth that are the adult age population that would be, housed in the jails that would be impacted.
But Sarah, those folks get subsumed anyway in the reentry initiative, so they don't really get treated differently.
Other than qualifying without the health criteria.
That's right. That's right.
All right. I'm just skimming after going live. How long should a correctional facility plan to wait for reimbursements to start coming in? This is a complicated question. This is not a straightforward question. So I think we're going to have to get back to you on that one, Sharon. There's lots of variables in that one. All right, and let's see. Just a couple things I wanted to emphasize is that DHCS received approval from CMS to fully fold in the CAA restrictions with our Justice Involved initiative. So it's all been subsumed into the same thing. I think we made that point. I'm just going to keep telling you that. Also, if any of the correctional partners have additional questions, please contact us and we're going to be happy to address that for you. All right, any final questions that people want to ask? I think we're doing pretty well going through them. All right, I think I'm going to pass this then back to you, Brian, or I'm not sure who's wrapping it up, I have to say.
I'm happy to do it. Let's go to the next slide. Wrap up and next steps. Next slide. Okay, all implementing partners, we invite you to attend office hours on Thursday, February 20th, 2025 from 10:30 to 11:30 a.m. Pacific time. The purpose of our office hours is to address any questions that folks had to follow up on the material that was presented at this Learning Collaborative event here today, or any other questions you have. You're welcome to submit office hours questions in advance to our email box that is linked here for the Callium Justice Advisory Group at dhcs.ca.gov. Next slide. And we're just going to tell you again that the office hours is Thursday, February 20th, 2025 from 10:30 to 11:30 a.m. Pacific time. And there's that email box again. I think that's all we've got. Anybody else have any other last words before we sign off?
Hey, Brian, we have a question that I'm going to ask at the end because I think it's kind of overarching for people. Is there any chance of loss of reimbursement due to changes in the federal funding with the administration change?
At this time, we don't see any particular reason to be concerned about loss of funding relative to this program. I have said before on one of these learning collaborative events that this program is enshrined. The ability to operate this demonstration is not just a regular demonstration that is more at the whim of federal CMS. The opportunity to operate a demonstration like this has been enshrined in federal law. So it's going to be a difficult thing to change. We think there is a lot of momentum and a lot of support for this, bipartisan support, nationwide, red and blue states. So, and certainly it is California state law. So we feel pretty good about this program going forward. We're moving full steam ahead, not taking our foot off the gas pedal.
Great, thanks. All right, well, I don't see any other further questions, so we think that we're going to give you some time back. Thank you all so much for joining us today. And we hope to see you at the office hours setting on February 20th. And again, if you do have other questions, feel free to send them on in.
Thanks, everyone.
Thank you so much, everyone, for participating today. And thanks to all of our speakers. Thanks, Brian.